Well, we have a really special guest and a special treat today on the Deep Sea Foundation educational channel. So I'm going to just jump right in and introduce my guest, who I met at a recent medical conference. And it was actually her microsurgeon, Dr. Pankaj Tiwari at Midwest Breast Anesthetics in Ohio, who introduced me to her. And he encouraged me to interview her for the pot or for the YouTube channel. And I'm like, after meeting her, I'm like, that was a really easy ask and task. So let me introduce Kait Schimmoeller, and she has been a surgical PA with Dr. Pankaj Tiwari and Dr. Ergen Kochak at Midwest Breast Anesthetics since 2019. Most recently, she has taken on the adventure of starting their medical spa, and it's called GloLux, correct, Kait?
Yep, GloLux. Yep.
GloLux. Okay, GloLux with 4 years of injectable experience. Now, Kaitlyn was born and raised in Findlay, Ohio. She graduated with a Bachelor of Science in Biology from the University of Findlay, in 2015. And she received her master's in physician assistant studies at Kettering College in 2017. Kaitlyn enjoys her role at Midwest Breast Anesthetics as she's able to connect and guide patients through their cancer and genetic journey. She also enjoys the aesthetic medical aspect as she helps women build confidence in a natural way. So, Kaitlyn's background as a physician assistant working with surgeons and now also working in the medical spa just seemed like a really nice blend for an interview today. Um, and Kaitlyn, really, first of all, welcome and thanks for joining me.
Yeah, thank you. I appreciate it. I'm excited.
Yeah, I think that I really became interested in your medical background working with surgeons at Midwest Breast, combined with your work with breast cancer patients. So, going through breast cancer treatment and surgery, it really involves a lot of emotional and physical changes. So you offer some spa treatments that can improve some of the effects of the treatments and surgery. Can you walk us through some of those procedures? And I think you even have some product to show us today when you're ready for that.
Yeah. So I think first and foremost, something very simple that we offer at the med spa, but then you'll also see our staff offering are our scar creams. That's kind of like a baseline, just easy something that you can do if you don't want to do any procedural type entities. And those are both Strata Med. This is what it looks like. A lot of our patients have it, and then Strata Derm. They are silicone based, and the main difference between the two is that Strata Med actually goes through a sterilization process. So it can be used starting 2 days post op. And so you can start treating your incisions much sooner than you used to be able to. It used to be that you had to let your incisions completely heal and be, kind of scars before you used a scar cream. And now they've created some entities that you can use a lot sooner. And so we do encourage our patients to get that early on and start using it from that aspect. But then when you switch over to the actual med spa portion, obviously most people in a surgical realm are worried about scars and kind of the physical appearance afterwards. And so we do microneedling for scars with and without PRP. And essentially, microneedling gets down deep into the dermis and allows for some collagen rebuilding. And it really allows the scar to turn over and heal a little bit faster. It can also help with the pigmentation of the scar down the road. And this can actually be started around 4 to 6 weeks post op, which is nice. So the scar doesn't have to be, or the incision doesn't have to be completely like healed to be able to do that, which is great. So that's one option. We do numb you before we do that, but most of the time incisions don't have a lot of sensation around that time. And you do need about 3 treatments to be able to fully get the benefit there. We also do weight loss. So some of our patients need to lose some weight prior to having a deep flap, or even they want to lose weight before they get their implants placed, just so they can make sure they get the appropriate skin tightening and such at that revision surgery. And so we do offer weight loss options as well to help kickstart some of those entities. A lot of our patients have had their ovaries removed, or they had chemo, or they're on now hormone blockers, things like that, that really don't help in the world of losing weight. And so when you've gained weight through this process, or even before, and you didn't have time to lose it because you didn't plan to have breast cancer, then you need some help to get that weight off. And so that is something we help with. And then, if you decide you need revisionary surgeries for loose skin or something down the road, our surgeons can help you with that. Other things that we have that are not specifically related to surgery themselves, but we offer are Botox or just other neuromodulator toxins like Dysport and Jeuveau. We have fillers for face. We also have skincare. And then I think our biggest hit with our post reconstruction patients is actually our facials. Patients love to come in and just kind of connect and relax. And so they'll schedule monthly facials to really just kind of revitalize and make themselves feel like shiny again, and just really feel more confident, which is nice.
Oh, I know, because, through treatment and surgery and the winter months, our face can dry out so much. I think I need to come for a facial right now, Kait.
Yes. Yeah, we should have done that instead.
I know.
Podcast while we
Yeah,
facial.
yes. Can I virtually transport myself through the Zoom here? So you mentioned something PRP that I don't know if all the people listening would know what that is, that you don't use that. So can you,
Yeah.
describe that a little bit more?
Yeah, absolutely. It is called plasma-rich protein, and it is a part of your blood. So we actually would draw a vial of blood while you're in the office, and we spin that blood down. And when you spin your blood down, it kind of separates between the white blood cell entities and the red blood cell entities. And so PRP, or the proteins, live within the white blood cell proteins. And so we extract that from the tube, and we actually use it while we're microneedling. And that carries a lot of healthy things you need to help heal faster. So when we're making those micro channels, that PRP will actually go down into those pores or into those channels. And it just gives you an extra burst of healing factors versus just the microneedling alone.
Okay, so you are using that within your product and your the system that you use for that.
Yep.
So boy, having gone through breast cancer twice, when you see women come into your spa for anything that you're working with them on, Kait, what transformation do you see in your breast cancer patients?
Yeah.
You must kind of observe the emotional and physical change as well.
Yeah, yeah, I think that I have the opportunity and I love so much as I get to see patients from the moment they walk in the door, from the very beginning of being diagnosed or kind of going through the genetic journey to
Mhm.
the very end. And so even before the med spa, I would always tell patients, I'm like, I understand, like right now, it feels like you're never going to make it through. Like there's so much to do, there's so much going on. But then you see them again in 6 months, through their surgeries, you see them again a year later, like you see them through the process. And the amount of confidence, one, that just comes over time from kind of getting out of the crazy, it's just astronomical to me. And I love it so much because you build relationships through surgery, which I still get to do, which I love. But then I get to see them after too. And I get to actually get to know them. I get to learn about all their kids and what they're doing for vacations and how they've really changed their outlook on life, which I absolutely love. Because I think something traumatic like that does that. I think it really makes you open other doors and really look deeper and figure out what you want in your life. And so I love bringing people into the medical spa because I get to help them kind of build that confidence back up. But they kind of naturally do it themselves as well along the way, which I love even more. They don't all need my pep talks, which I love.
I'm looking at your smile. I'm looking at your enthusiasm. I think when you get in your car in the morning, this is what motivates you to get to work. I can tell.
100%. Yeah. I mean, I would say that I live and breathe patient care. And that's like really all that truly matters to me. So if I can make anyone's day just a little bit better, that's my goal. And I think that when something is taken from you that you didn't plan on, right? Breast cancer wasn't a plan in in your book of life.
Mhm.
Um, that brings a lot of emotion, whether that's anger, sadness, just all of them, right? You can be happy, glad, mad, everything through the process. And I think having a familiar face from the very start of that process to the end of that process is important. And you need multiples of them. And so I have the opportunity to really do that. And I think that it matters. I think that it really changes people's point of view moving forward in life.
What you say is so true. And I talk about this sometimes on other podcasts or interviews that I do, Kate. What you're talking about is building trust. And you
Mhm.
need that, like you said, when you've gone through something that you had no plan to have happen in your life. So I love that. Okay. We're recording this on a Friday.
Mhm.
You have a very cool Instagram account, which I've checked out. So I want you to tell us about that.
Mhm.
I want you to tell us how we might book something at the spa and walk us through what a day at the spa would look like. Time
Yeah.
wise, what we can expect. I'm just going to take a little dreamy virtual visit here with you today.
Yes. And then I also have exciting news after that. So I'm going to leave a cliffhanger while I tell you that, and then we'll go to something fun.
Oh, I love
Uh,
cliffhangers. Yay.
so on Instagram, we are GloLux underscore at Midwest Breast,
Mhm.
and GloLux is GLOLUX. So it's a little bit different. But on there, you can actually, in our bio, link to our online booking itself. So you can book that way. You can book a consult, you can book an actual treatment. If you call into our office, you can talk to Erica and actually book a telehealth appointment with me if you'd like to before you come in to chat about options that we have. And then you can also go to our website, which is gloluxmedspa.com. And on there, you can actually click book appointment as well. If you don't know what you need or you don't know what you want, I would suggest booking a consult. And basically, all that will do is we can do treatment that same day, but at least we can have a long conversation together about kind of what the overall plan is. Um, yeah, so that's how you book a day in the life of coming to the spa. It depends on what you're having done. There might be some needles involved, there might not, there might just be relaxation, all sorts of goodies in store. But what I would say is that when you come, I go kind of head to toe on what's bothering you, what's not bothering you. I'll tell you everything from skincare to all the treatments we could do, like chemical peels all the way to injectables we can do to fix your concerns. So I don't like people coming in with just one avenue. And it's okay if you do, but we will talk about everything because in the med spa, one treatment doesn't fix everything. We really come up with like an overarching full plan that may take years or it may take a long time and you can do it over time, but at least you have an idea of what's going on and where we're headed and how we got to that. When you come in, you'll be greeted by Erica, who, if you've been in our office, she's at the front desk. And yeah, you're usually here from anywhere, depending on what you're having done, 20 minutes to a couple hours. Most facials are about a half hour to an hour long. And then all the toxins, they don't take long to inject. I actually talk to you longer than I inject you for. And then fillers and microneedling, you have to sit there with numbing medicine for a little while. So it does take some time. I would say my favorite thing is I have an Alexa. So we play whatever your favorite music is, whether it's a facial or an injection. I'm not your typical like background jazz music gal. I want you to be at home. So we play all sorts of good stuff in our office. So I like to learn that about people as well, which is really fun.
So I could have a facial and be listening to Dua Lipa.
Yeah, 100%. And if you want me to sing, I will. I'm not good at it, but I would.
Okay, an added bonus. Okay. Um, wow, this has been so much fun. We're going to put links so people can, find all that information you were talking about, Kate. Okay,
Yes.
drum roll.
Now the drum roll. I know, I know.
Drum roll. Do I
And who
need to
knows if
book,
it's
do I
gonna,
need to book a flight to Ohio for this? I mean,
yes, you will when you hear this. I
okay.
know, I know. So it's been in the making for a while, and who knows when this is going to air truly. So people may know about it from us before they know it from here, but who knows? Maybe you'll hear it here first when it airs. But GloLux just got a laser. It was just dropped off yesterday. And so we'll have opportunities for laser for hair restoration for our chemo patients, incisional treatments that'll be even more detailed than what microneedling can do. We'll have full facial resurfacing capabilities for multiple different kinds of lesions or like hyperpigmentation, acne scarring, wrinkles. And then also some tightening capabilities. So we'll be able to, if you lose weight, kind of tighten your jawline area or lift cheeks to some degree. So we're very excited about that. And it's a really big step. So I think it'll help not only our surgical patients, but also more of that cosmetic side of patient too.
Wow, that's exciting. You know what I think is interesting, and I've heard this before. Women who come to a microsurgeon, a plastic surgeon for reconstruction, I was one of them, okay? Um, you don't think about being a person who would walk into a plastic surgeon's office. But I just spoke to this about another couple of plastic surgeons just this week. What happens when you see that transformation and you have your reconstruction? You start looking in the mirror with a little bit more discerning eye. So these services that you provide, I think then can validate patients wanting to care for themselves, to treat themselves, to give themselves a little bit more boost in their recovery, their care, and what they can do after treatment and surgery.
Yeah, and I feel like that's where we excel is that our med spa is not driven by a cosmetic patient. It is driven by our reconstruction patients. And so everything we do is more medically based. And it's not that a cosmetic patient can't come in. If you want it for full cosmetics, girl, I got you. But I do really treat people truly from the reconstructive side. And so I'm looking at incisions, I'm doing post ops, I've pulled drains in the med spa. I mean, I've done it all because I am a surgical PA and that is what I do primarily right now. So I don't see it as, I'm like going into just a med spa and sitting down like every other person. It is really based toward that reconstruction patient. And I think that's really important and it makes people feel more confident and more comfortable when they walk in our door.
Well, thank you again for all this information. And I'm going to say Dr. Tawari hit a home run when he asked me to interview you. So we're going to give him that credit today, okay?
Well, I
But
think I'm the one that hit the home run. He gave me the job here. So
well, I think the patients hit a home run when they come to see you, Kate. Thank you so
well,
much
thank
for
you.
your time
Thank
today.
you. Yeah, I
It-
appreciate it, Terry.
yeah, I'm going to have to come see you. It's just
I know. I
just
know. I
gonna
think the
happen.
laser sold it.
Yeah. Thanks so much.
Yep. Have a good one.